All right, let's talk about your glaucoma. We're kind of at that same spot that we were before, where we were struggling with eye drops, and
Right.
initially we took you off of some of your eye drops because of the dry eyes that it was causing, irritation, redness. And the thing that really worked well for you initially was this medicine implant that I put in your eye in the office. Made a big difference in terms of how your eyes were feeling. But we're kind of at that point where that implant has, the effect of that implant is worn off. And your pressure's gone back up close to 20. And what we're trying to do is keep your pressure in the low teens if possible. So, we got a decision to make here. I kind of am nervous about going back to eye drops in addition to what you're taking right now. I don't know how you feel about that.
The eye drops, you just get to the point, it's too much, and you
Okay.
can't always, it seems like you're almost dosing your eyes every 2 or 3 minutes with eye
Yeah.
drops. My eyes would be scratchy
Okay. Okay.
as the time would wear on.
Right.
And I noticed I had a lot of redness
That's what that
around the
nighttime eye
eyes.
drop we
Yeah,
were doing.
yeah.
Yeah, I agree with you. I think if we could, I'd prefer not to use that therapy because we know what it did in the past.
Absolutely.
So really what I think would be a great option for us here is a different medicine implant called the iDose TR.
Okay.
Here's what I like about this implant. One, it is a tiny, small device implant that I insert inside your eye. The other thing I like about the implant is it's 24/7 release of medication. So this is a, pharmaceutical medication, preservative-free, again, on the inside of your eye, like the other implant. So it's not going to touch the surface of your eye. The additional thing that I love about this is the length of time that it can potentially last. So the studies show that actually this particular implant has the potential of lasting up to 3 years.
Oh, wow.
So we have a much longer runway here, right, in
Right.
controlling the pressure. With this medication implant, which up to now, as we have been putting it in more and more of our patients, we really in our practice have been observing that it's lasting, a longer period of time. So this will be my choice for you, is going the implant direction so that we don't have to add drops back in. And so if you're good with that, I would love to proceed with scheduling. Any other questions about it?
That sounds like a plan.
Okay.
Anything to get the pressure down.
Anything to get control. Okay, wonderful.
That's right.
So we'll move forward.